Healthcare is really important to all of us, but if we want it to be the best it can be, then we all need to work together. There are lots of opportunities for us to do this. Doctors and nurses know that feedback is important, whether it's good or bad. But for our feedback to be useful, we need to make sure that it's constructive. We need to be clear about what or who we're feeding back on and what we did or didn't like about it.
I find it rather useful when patients give me examples or solutions I can work with. It definitely helps me to improve my skills and practice.
I want to tell my doctor what a good job they've done.
It's lovely when you get a card, especially from family members and carers.
Sometimes it's so busy in here, I can be a bit abrupt. I suppose I don't even realise it.
What's wrong?
Is this going to come back to haunt me?
No, feedback doesn't have our name on it. Doctors and nurses are interested in what we have to say and not who we are.
Can I feed back on my team?
What about parking?
Appointments?
Waiting times, hospital food,
Receptionists and other patients.
They all make a difference to our experience.
Absolutely. And that's feeding back on services, which we can also do.
We can work together to solve problems.
But we need to know what the problems are because we're not mind readers.
We will do our best to improve things and explain things if we can't.
There are some rare occasions when a doctor may be a risk to patients. There is a separate procedure for these rare occasions called fitness to practice.
So I can feedback on my doctor,
Feedback on my team.
feedback on services,
and make a complaint if needed.
But who do I give my feedback to?
For any feedback on GP surgeries, we should talk to the practice manager. For hospitals and other services, we should talk to the Patient Advice Liaison Services, or PALS, who are based in every hospital.
Can we do more than just give feedback?
Of course we can. We can also be involved in patient participation groups. Every doctor's surgery has to have one, so ask your practice manager for more information.
When we were worried about the future of our GP practice, we came together to lobby the powers that be, to make them understand that we care and wanted answers.
Once we got together, we realised there were lots of other things we could do, like having a healthy eating club or weight loss classes, as well as being a voice for other patients and their concerns. The PPG is your opportunity to get involved in building a healthier community. Your service, your voice.
So now we know some of the different ways we can get involved. All our voices are important, our service, our voice. So let's all start working together to make it the best it can be.